Hello guys, I am Sudarshan. I am third year MBBS student, and in this video we are going to discuss about the penicillins. These are antibiotic drugs. So these are beta lactam group of drugs. In this we have cephalosporins, penicillins, etc. Okay. So in this particular video we are going to see the mechanism of action of the penicillin, definition of penicillin, and the mechanism of bacterial resistant to the penicillin. Okay. So we'll go one by one. Stay tuned till the last of the video, and if you like this video, do subscribe to my channel. First of all, the definition of penicillin. This is the first antibiotic developed and used clinically. It was discovered accidentally by the Alexander Fleming, so it was an accidental discovery. Next is mechanism of action. Beta lactam antibiotics produce bactericidal effect by inhibiting cell wall synthesis in susceptible bacteria. So they basically inhibits the cell wall synthesis, and which will lead to the bactericidal effect. So steps involved in this are the bacterial cell wall contains peptidoglycan, which contains glycan chain and peptide chain. In glycan chain we have NAM and NAG, means N-acetyl muramic acid and N-acetyl glycosamine. And in the peptide chain has pentaglycine attached to it. In next point is transpeptidases. These are penicillin binding proteins, PBPs. Okay, they causes cross linking between this pentaglycine and adjacent peptide chain by cleavage of terminal D-alanine group. Okay, which will lead to cross-linking, and cross-linking make the cell wall, CW means cell wall, rigid and stable. Cross-linking makes the cell wall rigid and stable. Next, this beta lactams or penicillins, what they do is they are structural analog of D-alanine. This D-alanine, they inhibit the transpeptidases. Which will lead to inhibition of cross-linking and cell wall synthesis, and which will ultimately lead to lysis of the bacteria. Few important points also. Beta lactams or penicillins exerts their bactericidal effect when the bacteria is actively multiplying and synthesizing cell wall. So when they are most active, when the bacteria is actively multiplying and synthesizing the cell wall. The gram-negative bacteria are less susceptible to the penicillin than gram-positive bacteria due to the presence of additional outer lipopolysaccharide layer in the cell wall of this gram-negative bacteria. So gram-negative bacteria have this additional layer lipopolysaccharide in their cell wall. That's why they are less susceptible to the penicillin than gram-positive bacteria. Last point is mechanism of bacterial resistance to the penicillin. So after a period of time, bacteria develops resistance in some cases to the penicillin. So this mechanism is discussed as follows. Bacteria develop resistance by these three mechanisms. First one is by producing beta lactamases. They destroy the beta lactam ring. Example, in the Staphylococcus aureus, E. coli, gonococci, Haemophilus influenzae, etc. Next mechanism is they produce bacterial resistance to the penicillin by altered PBPs, penicillin binding proteins, or also called as transpeptidases, altered transpeptidases. They are having less affinity for the beta lactams. Example, Streptococcus pneumoniae. Lastly, last mechanism is by decreased ability of the drug, that is penicillin, to penetrate to its site of action. Bacteria develops resistance by decreasing ability of the drug to penetrate to its site of action. Thank you for watching. If you like this video, do subscribe to my channel and stay tuned for the upcoming videos also. Thank you.